and welcome to today's webinar resident series. Today's session is Shade Science and Communication, a simplified approach, being presented by Dennis Urban, CDT, Clinical Director of Education here at NDX. And with that, it is my pleasure to turn the realm over to Adam Dreyfus, NDX Corporate Account Manager for University, Government, and Institutions. Take it away, Adam.
Jessica, good morning, and thank you so much. And thank you, everybody, for joining us this morning on the Greater New York Area Residency programs. First, I want to just say thank you for all your continued support. Myself, Dennis, Jessica, and the entire DSG NDX organization really appreciates all your support today, tomorrow, and for the future. We really do hope that you're enjoying your residency so far, and please know that we are here to support you in any way possible. Most of you have seen me inside your clinics. If you have not seen me recently, I promise you I will be there real soon. We had a lot of different holidays in the month of September, and now we're rolling into October really strong, so we want to thank all of you. This is an amazing topic that we have today, and without further ado, I'd like to bring you Dennis Urban. Have a wonderful day, everybody, and speak to you real soon.
All right. Well, thank you, Adam, and thank you, Jessica, and thank you, everybody, for joining us this morning. Good morning to all. As Adam mentioned, this is an information-packed seminar. We have a lot of information, and many times when we do these types of seminars, especially with shade communication, they're an all-day program. So I try to condense a lot of this into 1 hour today. A little less than an hour, sorry, because I know everybody has to leave by about 8:50, 9 o'clock. So if we look at at shade communication, we live in a preoccupied world with aesthetics, and the patient is concerned more than ever with the quality of their smile, as you all know. And this includes aesthetic demands on maxillary anterior teeth. And a big factor of that superior aesthetic outcome is shade integrity. And dental professionals, including dentists and dental technicians, have their work cut out for them at times, finding the perfect shade and shade match for a restoration, and it's more critical than ever before. So we're going to go through this morning, and we're going to start with understanding color and perception. We'll go through some of the basics, which you probably know already, but it's good to review it, and science and theory, shade taking techniques, and we'll touch on some of the manual and electric shade taking techniques also as we get further down into the presentation. So if you look at the color, it's the science of color and shade selection. If you look at the color, it's, light is color and color is light, so it's important. You need that light, in the correct light when you're taking a shade. So we'll look at, different aspects of, shade communication. And, if we look at the primary cause of remakes, poor color match is up there. Open margins is second, open contacts. Still the number one cause for remakes is impression taking, the inaccurate impressions. But look at the poor color match as far as the percentage of remakes. It's like 30% of remakes out there. So we want to make sure we get the correct shade. And the most common causes of color mismatches, it's too bright, it's the wrong hue, too dark, too opaque, and there's other factors also. But, especially with anterior restorations, we want to make sure we get that right shade, correct shade. And we have a scientific way of doing that with the shade guides that we have out here today and at our hands today. So, and light is a big part of that. We talked about that earlier. This is the same restoration in different lighting situations. And look at that. It looks like we're going from a B1 to a C1. It's amazing how light has an effect on when you're taking a shade. So it's really important to have the correct lighting in the operatory. And what's the best tools? One of the best tools of color is your eye. So you have your eye, your shade guide, and the correct lighting. As I mentioned, light is color. So we need the necessary things to see color, and that's your light source and your sample or object to interact with the light energy, and a receiver or processor. So we have to have the correct shade guides. We'll touch on the shade guides in a little while, the different ones that are out on the market, because it can get confusing. But we're going to talk about one of the most scientific shade guides on the market, and that's a 3D master shade guide. So most of the light we perceive is reflected and not direct. So it's the color that we see is a portion of the visible light spectrum, and that is not absorbed by an object but reflected back to our eye, as we see here. And look at this photo here. Is the grass green? Well, all the colors are available, but the color that is not absorbed is reflected, and therefore we see that color. So that color that's reflected is green. So keep that in mind when you're taking a shade also. And perception is the light that reaches our eye when we view an object, and we perceive things differently. We can have 3 or 4 people in the same room and they'll take a shade and they'll give us different shades, so this light during perception has been changed by the object, and interaction with that light at the object allows the perception of color. No light, no color. So we look at perception. Perception can play tricks on our eyes. So I'm going to show a couple of different photos here that is playing tricks on your eyes. So certain things can have a real detrimental effect. But even this photo here, you look at this photo here. If you stare at it, it looks like the circles are turning, and they're actually not. They're staying still. And you've probably seen some of these, in the past that play tricks on your eyes. And even something like this. Well, the horizontal lines parallel, or do they slope? Well, they're all parallel, but they look like they're sloping. And this is a pretty cool one. Is it a column in the middle, or is it the back wall? So it's difficult to see, and if you look at these pictures of these nuns walking, the ones up front look like they're larger, but they're all the same size, and the same type of perception can apply when you're taking shades. So it's really important to do things the correct way. Right. So we're going to go over some of the scientific terms and properties of light. And, you can do a whole course just on this. We're just going to touch on this today here. So, and some of those properties are transparency, translucency, opacity, absorption, metamerism, reflection, refraction, gloss, fluorescence, and opalescence. And this is really important to not only in the clinical standing, but also in the laboratory, because we utilize materials that aid in the reflection, refraction, fluorescence, and opalescence of a restoration. So these are real important terms. So we're going to touch on these real quickly here and get into some of the other aspects of shade taking. So transparency, you're capable of transmitting a light so that objects can be seen as though there were no intervening material. So like a piece of glass, it's transparent. And when we're building up porcelain, we take into mind consideration all these things, including transparency and translucency. And translucency is the degree to which light is transmitted rather than absorbed or reflected. And opacity, the ability of an object to absorb light. We see more opacious or opacity type restorations on the posterior restorations, even with zirconia. Monolithic zirconia, it's more opaque, so just keep that in mind when you're thinking about opacity. And absorption is determined by the density and the makeup of the material that the light travels through. So even when we're layering porcelain on an anterior crown, it could be zirconia also, but it's the degree of absorption that's going to give you that color and that density. And of course, the metamerism is the appearance of certain color variations depending on the light source. And let's go back to this 1 second. The best light source is the natural diffused light. The worst light source is that harsh, direct dental chair light. And many times there's not the correct lighting in those dental chair lights. So, and the newer ones they have out on the market today, they do take that into consideration in shade taking. And of course, the reflection is when a light strikes a solid object, it's bounced back, and a mirror is reflective. And there's your refraction. Refraction is something like a rainbow. You can see that. So all these, are considered. You consider these terms when we're doing restorations, including posterior and anterior restorations. And surface gloss is the optimal optical property that produces a lustrous appearance. And certain, patients and doctors like certain gloss or glazes on the restoration. Some of them don't. So it's according to what the patient likes. And on composite and porcelain, the surface gloss decreases with increasing surface roughness. And that's what we see a lot. We've got doctors in the laboratory say, we just want that slight surface gloss. We don't really want a high gloss or high glaze on our restorations. And it's, I think it's up to the patient, what the patient really likes and what they feel comfortable with. And high gloss lightens the color appearance. So, and the fluorescence is the emission of light by an object at wavelengths different from those of the incident light. And this is what makes teeth look natural. And natural teeth emit a visible light when exposed to UV light. And then we have opalescence, and that includes the Tyndall effect. And the Tyndall effect is, under direct light, the shorter wavelengths are reflected from the fine particles of natural dentin and porcelain that gives it a blush appearance, and the longer wavelengths are absorbed. So just to keep that in mind, I know it's a lot of information. The shade taking is a real detailed, in-depth subject, you know. So, and again, we're just touching on that today. So, and this is some of the basic things you learn in school. Light is energy, and it travels in straight lines at 186,282 miles per second. And it's the frequency of light that creates a sensation of color. And we'll talk about frequency in a minute. And there's your frequency here. But you know what's interesting is that, you know, light is energy in the form of a wave or a proton. And this is the visible light spectrum here, as you can see here. And, you know, the wavelength of visible light that can be perceived by the human eye is only up to 700 nanometers. And, you know, we'll elaborate on that in a minute, but the light spectrum that is out there, we only see just a part of it, you know. So, and then we have color receptors, you know, and color receptors, you know, cones respond to colors, especially the red, green, and blue. And we'll talk about the red RGB later on, and because a lot of the colorimeters out there in the market, they respond to red, green, and blue when you're taking a shade. And these are the electronic shade taking systems. And then your rods respond to light and dark only. So we're gonna elaborate on that a little bit in a few minutes here. So now, if you see the rod response here on the top, and that's light and dark, look at the persistence. It's a long persistence. So when you look at the light and dark, it stays in your brain, in your eye for a longer time. So that latency period is a longer period. And with the cone response, which is the color response, it's much shorter. So the longer you stare at things and then you're taking a shade, the more disruptive it gets, you know. So, and it's not as accurate. So, you know, the color content of the illuminant acts within the object being perceived. So, and there's a lot of different illuminants out there. You want to use something that's going to be natural sunlight. D50 illuminant is pretty the closest to natural sunlight. So you want to make sure that the shade and the natural light is there when you're taking a shade. And many times we'll do this at the laboratory also. You know, a lot of our laboratories have operatories, and the patient is sent there by the doctor, and we take a shade in the laboratory because we have all the correct light and the shade taking systems. So light conflicts in the operatory. You know, of course, I mentioned earlier, light from the window, light from the hallway, light from the color corrected tubes, dirt and dust on the tubes. That all has an effect on the light and when you're taking a shade. So let's talk about teeth. I'm going through this pretty quickly today because there's a lot of information I want to cover. So let's talk about teeth a little bit here. So there's two terms, you know, specular reflection and diffuse reflection. And if the light is reflected from a surface, little or no absorption will occur, and reflected light is the same as the source light when we talk about specular reflection. And diffuse reflection is a light that penetrates an object and is reflected back. So look at the shape of the tooth, and that defines where the reflection will be. You know, if you look at this diagram, this is a great diagram of this tooth here. You know, it shows diffuse reflection, mirror reflection, incidental light, translucency on the incisal edge, direct transmission. Just take a look at this. And this is what we try to achieve when we're making our restorations, you know, and not just crown and bridge. You look at the denture teeth that are out there today. A lot of the denture teeth mimic natural dentition or natural shading, and they have different levels of shading also. So it's more natural looking, and the denture doesn't look like the denture. So, but this is a pretty cool photograph, and I like to show this because it shows all the reflection and refraction of the tooth. And we try to mimic this when we're building up our porcelain. So, and layering and creating various levels of opacity mimics that tooth structure using base dentin, and enamel, as you can see here. So it's pretty amazing. That's why it takes so long to learn and build up porcelain and become a ceramist. So, you know, hats off to those master ceramists out there who can mimic that natural dentition on a regular basis. So let's talk about understanding and communication of color. Albert Munsell, he's like one of the leading artists and teachers on shades, you know, and he brought order to color. You know, he developed the first numerical scheme and laid the foundations out for color science. And we'll talk about this color science. And, you know, we look at this color sphere, and this color sphere represents the entire universe of color, and is scientifically known as the CIE or LAB sphere, and is created as an international standard for color representation. And this terminology is expressed in nearly every industry throughout the world, defining color coordinates. And this, you know, the spheric globe contains over 10 million color variables within it. So it's pretty neat how they this globe or sphere encompasses all those colors. And if you look at the CIE sphere, and it has 3 axes. I'm going to show this in a second here. So 3-dimensional model with 3 independent variables. The lightness or value of colors is the highest at the top of the pole and darkens to the south pole. Chroma is the color's richness or saturation, and originates from the core to the outward edge, as you can see here. And hue is the actual name of the color and rotates around the whole sphere. So we'll get into this. I'm going to do some comparisons with a shade guide against this actual sphere in a few minutes. And visual perceptions, only out of all those shades I mentioned before, only 100 variations are visibly noticeable by the human eye. And they fall into a banana-shaped area, we'll show in a second. And there are approximately maybe 1,000 measurable dental shades out there. So if you look at your shade guides with maybe 20 shade tabs on them or whatever, you look at that, but there's 1,000 measurable dental shades out there. So and the shade guide system that I'm going to show here is in a little while is going to be the 3D master shade taking system. So talk about Munsell's hue. So it's a specific wavelength. It's the basic color of the shade. And the cones in the retina, like I mentioned before, sense those colors. I'm not going to get into too much, but we have 6 million cones in number, and there's 3 types of cones. So the primary and secondary colors, they're perceived when one of the RG, red, green, and blue wavelengths are absorbed. And we see red and green. Red and green is absorbed, etc. So secondary colors is formed by combining 2 of the primary colors, like red and yellow equals orange, those types of things there. So, and we all learned this in school, so I think we all did, so it still sticks in my mind when we were learning colors in art when I was in school. So, but color perception, the lack of cones for color perception is prevalent in a lot of people, so the lack of red and green, or males are 8 to 12% of the population, and females is only 0.5%. When I used to work for a company in Germany, there was a shade taking company. They used to go to Germany and watch them make denture teeth, and used to lay these denture teeth, lay the colors of the denture teeth in a specific motion. And I looked around the room, and they had maybe 15 to 20 female technicians doing this, and they were making denture teeth. And the reason why, I asked, I said, why do you have just females doing this? They said, well, it's the color perception. Males lack the cones for color perception, and females have a more accurate eye for taking shades. So I thought that was pretty neat when I used to go to Germany, and I was at the Vita facility in Germany. So the strengthening of the color, that's Munsell's chroma, candy apple red, chrome yellow, forest green, etc. Now I'm going to just touch on this a little bit here, so I'm not going to get too much into it. But it's the strength of the color, pretty much, when you talk about Munsell's chroma or any chroma. And the value is the lightness of a color, light to dark, light green, light red, white, etc. And it's the quality by which we distinguish lighter shades from darker ones. And then the value is the amount of white. And we'll talk about some tricks of how to evaluate the amount of light when taking a shade. So, with value, there's 120 million rods in the retina, the perception of value. And this is why you have that rate where it lasts longer when you're taking a shade on value than it does with color. And how about this shade guide here? This is a shade guide from 1927. This was one of the first Vita shade guides, Zahnfabrik, which in Bad Sachsen in Germany. And this was made in 1927. So it's an old shade guide. And you have so many shade guides out there on the market to choose from. What do you choose? We choose the one that's going to be most accurate. Choose the one in which the laboratory is used to working with also. Say for instance, I'm just going to throw out Vita, so most of the times we're using, a Vita shaded porcelain. So, really don't want to, like a Bioform shade guide, because then we'd have to try to match that shade guide. So if you deal with the laboratory, just find out what kind of porcelain they're using and utilize that type of shade guide, and I think the Vita shade guide and Vita Classical and Vita 3D is probably one of the most prevalent shade guides used. And even the other companies like Ivoclar and Dentsply, they actually have, they make their denture teeth and porcelains to match Vita shades also. Well, the exact, not to the extent where Vita is exactly matching their shades. So color science and communication, we want to understand the science of color. We want to use an adaptable tooth guide and employ a teachable system when we're taking shades. And there are some training tools out on the market that I'm going to show you that you can utilize, in the operatory to really get proficient at taking shades. So the current shade systems, the Vitapan Classical Shade Guide, the industry standard, it was been an industry standard since 1956. And when I found out about this shade guide was developed for taking denture shades and for denture teeth. And can you imagine all these years since 1956, they've been using this shade guide for taking crown and bridge shades, so it was like acclimated over to the crown and bridge side, but originally it was developed to make for denture teeth. So it's just pretty cool. And classic and competitive shade systems lack uniformity, and it's really not a standardized method for measuring color. Let's see how we're doing with time here. Good. Okay, good. All right, so we're going to get into this a little bit more in depth here. So, but the limitations of the current shade systems are color gaps. Say sometimes you're taking a shade, you have an A1 or an A2, or you go from A2 to A3. Well, what if you wanted that A1.5 or something in between? It's hard to get those types of shades with the existing shade guides that were out there. And this is where 3D Master comes in. We'll elaborate on that in a minute. So it's an inaccurate interpolation, and there's intervals between those shades, and they don't yield a single discernible intermediate shade. And that's important when you're taking a shade, especially for anterior restorations. And they're really not systematic, and shades are pretty much the one that I just showed you, that Vita shade guide and all the other shade guides that are out there, it's pretty much our value shade guides. They're not really taking in all the hue and chroma when you're taking a shade. And so we'll elaborate on that a little bit. But if you look at this current shade taking system, this is the current, the current system is located within the tooth color space, and you'll see some teeth out of that space. And that's, that they're all clustered together, and they're partially covering other shades, so such shades within these clusters have a similar value or lightness with differing hues, like I mentioned before. And so patient shades are located between the above samples, and they cannot be reliably matched consistently. So we're going to talk about a consistent way of taking shades. So there's your old shade guide. This is a classical shade guide. And there's nothing wrong with this. It's still being used. But if you really want to get those in-depth shades, especially on interior restorations, I recommend like a 3D Master shade guide with that. So there's your Vitapan Classical Shade from A1, to D4, and it's pretty much a value type shade guide, So and if you look at these shades here from A1 to C4 and B and everything in between D4. Some of those are outside the spectrum there, and they're clustered together. They're overlapping, and this is hard to get a good accurate shade when we're looking at that. So, and I broke this up into value. You can see the lightness and darkness of these shades. So look at the you got the lighter ones on lighter value, and goes all the way to the darker value on the shade guide. And as it's broken up into this section, these sections here. So we went from an intuitive arrangement, and now we have a scientific arrangement with the 3D Master Shade Guide. And I'm not trying to sell you a shade guide here. I'm just telling you what works in the laboratory, in the operatory rather, taking a shade, and what works best in communication with us in the laboratory when we're making restorations. Let's go from intuitive to scientific here. So we went subjective to systematic arrangement here, and this is the Vita Tooth Master Shade Guide. We're going to elaborate on how to take this in a little while. So, and we'll go from step by step when we're doing our, taking our shades here. So we're going from lighter to darker value, richer to paler, and reddish to yellowish. And I'm going to go through each step here, taking the shade. So look at the 3D Master shades on the left. Orderly it is compared to the regular Vita Classic shades here on the right. They fit into that sphere on the left-hand side, that banana-shaped sphere. So there's more shades that you can take with a 3D Master that fit into that color sphere. And distribution differs by each shade being uniquely extending the range. Double the perceived tooth shade space, which is pretty cool. So they have 26 shades, and they're systematically organized, and it addresses the needs for additional shades with high and low values. And 17% of the shades measured with conventional shade guides needed required correction. 99% of the shades measured with 3D Master required no further correction, which is great since we don't have to worry about remakes. And it's really tough on patients. You have to deal with the patients. Make sure they like that shade before we make that restoration. You know, just I'm going to elaborate on that in a few minutes too. Make sure they like that shade, you know, that you take, show them the shade guides and the shade tab, and show them the shade that they're going to get on their restorations. So what influences, what are the basics, what do we need? All these contrasts in the operatory to hue, chroma, and value. Look at these restorations here. I mean, this is all the same restoration in this different light, you know, except the ones on the left-hand side here. That's the original restoration here. But look at, they're all in different light values here. So you get different colors. So we talked about color deficiency before, you know, trouble seeing red or blue. It's the absence of photosensitive pigments, especially in males. So we have to take that in consideration also. And if you look at this, if you can see the number 8 in there, you're okay. You know, so I'm sure you've seen this photo before. If you can see the number 45 in there, you're in good shape also. So you get that color perception is good. So with age, the cornea yellows, and therefore it imparts a yellow bias when you're taking a shade. And then you have trouble with white versus yellow. And that starts after you're 30 years old. And it's noticeably more after 50 years old, and clinically significant after 60. You know, so you have to keep that in mind. And operator influences with fatigue. You know, color cannot be perceived accurately by tired eyes. So it's good to have an extra pair of eyes to look at these shades while you're taking a shade. And the color may be faded or blurry and can lead to an inaccurate match. And emotions too. Emotions affect pupillary diameter. So be sure you're in a good mood when you're taking a shade. All right. So it has an absolute effect on color perception. So, and then caffeine, oral contraceptives, all these things have an effect on taking shades. It makes you see different colors. And we don't have a lot of time to get into that today, but it's just, I like to mention it. So, and binocular difference, you know, so put two identical objects placed side by side can appear different. And placing a shade tab above or below the tooth versus on either side can have an effect also. So look at this photo here. The shade appears very different between these two identical A1 shade tabs when they're compared side by side in a maxillary and mandibular position. So we want to make sure they're in the right position when you're taking the shade. You're taking it at a maxillary shade. You want to do that shade tab on the left, and on the lower, you do the shade tab on the right. So what about bleaching? Okay, well, people want white teeth. You know, if the patient is considering the process of bleaching, do not attempt to take the final shade at this point. You know, it's a guaranteed remake. You know, if the patient is bleaching at home, advise them to stop with their, with their teeth when teeth match the white of their eyes, because you really want them that white. Some patients like really white teeth though. So an aesthetic balance is necessary though, and an aesthetic balance with their face. And if the patient has completed the bleaching process, do not take this shade until about a week after the bleaching is done. It's common for a slight bounce back to occur immediately after bleaching is finished. So, there's so many patients out there that want that really white shade, and sometimes it doesn't look natural, but, we give the patient what they want. So this is a bleaching shade guide that's out on the market. You can utilize this when you're bleaching. You want to pick a certain shade that you want the patient to reach, pick that shade. And when it is reached, stop, and then we can wait a little while, and then we can make the restoration. Now, this patient here wants something really white, but we don't have something white on the shade guide. Do you have anything lighter? Yes, we do. We have a new shade called TBW. It's called Toilet Bowl White. So I like to put this in there. A friend of mine took this picture. He's a dentist, so I like to throw that in there. But yeah, sometimes the teeth are so white, the teeth walk into the room before the patient do. It's especially with denture patients. Get a lot of 80-year-old, 70, 80-year-old denture patients who really want that white look, and it just doesn't look natural. But a lot of times they insist on it, and that's what we give them. So other influencing factors: dehydration, lipstick, coloring, patient's complexion, and patient's expectations. We really want to meet in a realistic way those patient expectations. So when do we select a shade? So it's before the rubber dam application, 2 weeks after the bleaching, after the teeth have been polished, and before the preparation. Really important. And what armamentarium is a shade guide, blue paper, hand mirror, and a detailed lab script. Are we doing time? Okay, good. Okay, and I talk about that detailed lab script because sometimes we'll get anterior restorations or a 6-unit anterior bridge, and it said A2. you really have to break it down on, especially on anterior teeth, into like 3 various shades, from the cervical, the midsection of the tooth, and the incisal ledge. Give us a shade, a breakdown on those shades, because the shade is definitely different. And on it, you don't want something to look opacious or monolithic on an anterior restoration. So keep that in mind. Why do we need blue tape paper? Because our eyes have to adapt to their surroundings and color or light levels. And, the cones become depleted for the pigments of the yellow and orange. So, look at that blue paper after you're taking a shade, and it brings you back to that more perceptive mode and more accurate mode when you're taking the shade. So we need to cleanse the memory periodically while selecting that shade. Without cleansing, you'll have difficulty perceiving true color. So stare at that paper for about 30 to 40 seconds. You can use any blue surface, such as the pigmentation bibs, wall, whatever you need to use. It works well. Hand mirror. The patient is not happy. There's no one happy with the shade selection. So give that hand mirror to the patient, show them the shade selection, and that'll help you get a more accurate restoration and no less remakes and adjustments. So that detailed lab script I talked about before, just keep that in mind when you're writing those lab scripts. And I know Adam and I go into a lot of your facilities and we do a little presentation of what we need in the laboratory as far as information on a lab script. So. And also, with the abutment shades for all ceramic restorations, always take a shade of the preparation when prescribing an all ceramic restoration. I'm sure all you do that. So the dark colored prep will have a direct effect on the final shade of the restoration and must be compensated for in the laboratory. All righty. So we talked about all ceramic restorations, designate the final desired shade and the stump shade when you're sending that restoration to the laboratory. Patients should be in an upright position, so if you narrowed your shade to 2 shades, select the lighter of the 2. That's my recommendation. I've seen that over the years. It's much easier to increase the chroma or lower the value of a restoration than it is to make lighter or darker. So don't stare at the shade for more than 5 or 10 seconds, so it's important. So remember that single central incisor is the most difficult shade to match. So sometimes you're going to be going crazy trying to match that shade. And advise the patient of this as well, because these restorations sometimes require additional adjustments. Allow the patient to review your choice in an upright position. Make sure they hold the mirror about arm's length when you're taking the shade. This also applies when the patient is evaluating the restoration at delivery. Okay. Shades should be selected prior to the rubber dam, as I mentioned before, and the tooth to be matched should be polished along with the surrounding dentition. Color corrected light is really important. Have the patient run the tongue over the teeth before you're taking that shade also, and turn that chair light off. So we talked about value, limiting the amount of value. You can squint your eye, and that'll limit the amount of light received in the eye age and determining value. So keep that in mind also. Don't stare at the 5 seconds that the colors start to blend. So let's talk a little about the Vita 3D Master Shade Guide, and it's 26 shades. And the first thing we want to do with the shade guide, and I laugh at this because when this shade guide first came out, a lot of dental offices buying this, even us in the laboratory, bought the shade guide, and we didn't understand how to use it. So a lot of times it went in the top drawer and never was taken out again. So, but there's a couple of different methods to taking these types of shades, and one of them is the one I'm going to show you now, and it's going to be an easier method in a few minutes I'm going to show. So first thing I want to do is determine the lightness of value. So you look at the 5 groups here from across here. Determine which group is going to match your value. Select group from 1 through 5 and start the selection with the darkest group and work your way back to a lighter group. And after you select that, you're going to select the chroma. On the basis of lightness, take the middle U group, M, for determine the chroma, and spread the samples out like a fan. And select one of these 3 shade samples. And then we're going to determine a U, and it's going to go from the left to the right, and then check whether the natural tooth is more reddish or more yellowish, and then the sample selected. And that's your pretty much the 3 steps, But there's an easier way to do this, and there's a 2-step way to do this, and we're going to talk about that in a minute. But value is found more in the 3 group, more than 50% of test patients, and U is found in the M group, more than 50% of test patients also. So this comes to some of you might have seen it. We have this a lot of the universities. It's called the Vita Linear Shade Guide, and it's improved. It's faster. It's a faster shade selection process. So it's a nice little shade guide. All these shade tabs are put into this little case, and the first thing you're doing is going to take out the value, and you take out the value, and it's you have your 5 sections here. select the value from dark to lighter, pick that value and go to that section 1, 2, 3, 4, or 5. In this particular shade guide here, we had section 2. Excuse me. And then so then we select the chroma and hue in one swipe here. So it was a 2-step procedure, selecting the chroma and hue. And once your selection has been made, confirm it with another team member. So, excuse me, my throat is not agreeing with me here. So anyway, so that's pretty much the procedure of taking that 3D master shade. Make sure you write everything in detail in the script. We're going to go through a little bit of the electronic shade systems now, and I think we're going to be just perfectly with do perfectly with the time today also. So we have 3 things here: colorimeter, spectrophotometer, and intraoral scanners. So the current applications in the industry, in different industries, are paints, textiles, printing, photography, plastics, and of course dental. So these are all use electronic shade taking systems. And one of the most popular ones is the colorimeter, not the most popular, but it's popular. And it has 3 sensors. Like I mentioned before, R, G, and B, red, green, and blue. And this type of application is also utilized with intraoral scanners. And these are all primary colors. Then there's the spectrophotometer. And this is pretty much similar to, say, if you go to Lowe's or Home Depot or something like that, they actually use a spectrophotometer to match the existing paint chips or the paint colors that you have, and they match that specific color. Well, the same type of technology was applied over to the dental side when the Vita Easy Shade was made. So it measures spectral reflectance, has many sensors, it sees the entire visible spectrum of color. You know, not like our eyes, it sees the entire visible spectrum of color. So, you know, real quickly here, this is another course that I could put on with the Easy Shade. You know, it's going to apply this to 3 different sections of the tooth, you know, and it's going to give us the 3D Master Shade and the Vita Classic Shade. So it's an easy way to do this. The thing is, you know, I get a lot of calls saying, you know, I'm not getting the accuracy I usually get with on the Easy Shade. Well, you have to calibrate it on a regular basis. You have to upload new software on a regular basis also, and this can be done through the manufacturer. So it's a spectrophotometer. It uses multiple miniature spectrophotometers, and this is what's giving you your accurate shade. And it allows an accurate shade to be taken regardless of lighting conditions. So you can shut all the lights off in your operatory and still take an accurate shade. And it's an intuitive approach with increasing levels of data by touching a touch display screen also. So, and then, you know, it's intraoral scanners, I mentioned before, they're used for texture-based shade matching. And, you know, it's BRDF, and it has 12 different processes, but it elects a single preferred geometry from that data set, you know, and it factors in all angles and changes in lighting intensity. So some of these, you know, are pretty accurate. A lot of these, you know, intraoral shade taking systems are pretty accurate out there. So Carestream is one of them. It's great. It's a great system. Not advocating, but Carestream, you have 3Shape. You have a number of different companies out there utilizing this. And so instead of determining a shade from a single RBG value, the smart shade technology for Carestream, they use a bidirectional reflective distribution function, and that's called BRDF. It provides more of a true to life match. So it's gotten some great reviews also. And then it also on the screen, it shows you a breakdown of these shades, even the stump shade. It gives you that report, and you can print out this report or email it to the laboratory. Same thing with the other shade systems. Could be, you know, with 3Shape, could be with the Carestream, with Vita. You can actually, you know, email these to the laboratory and give you a good breakdown of the shade. So when our ceramists are building up these restorations, we have that exact information at our fingertips. 3Shape Trios is another shade, Itero, all these, there's a lot to choose from. I don't have time to get into all of them today, but, and then there's digital photography. Like we get a lot of digital photographs in a laboratory of shades, and a lot of times they're just not accurate. You know, digital cameras have, you know, they're used in capturing shade details. One of the disadvantages is that most captured images use the standard RGB, or red, green, and blue, which has limitations. So, and the color of the image is significantly impacted by the light source. So that's why we get our variations. We have a good photographer, you know, a lot of good photographers in dentistry, you know, and good photographer with a good light system, we get really accurate shades with digital photography. And then finally, there's something called a shade wave. And, Adam can even come into your operatory and show you how to use this. This is a great system also. And it's utilizing iPhone technology. And it's really great. It's a software system that you'll have in the operatory, and we'll have it at the laboratory. It's a great communication system. And it only uses 2 shade tabs as a color correcting reference. And it's web-based, HIPAA compliant, and it integrates and automates iPhone photography with ShadeWave Mobile. And it's a little app that you put on your phone. And I'm sure some of you have seen this already, but the shade is being taken. All we have to do is use those same shade tabs all the time, really. And it's going to use that as a reference for taking that shade. So we use shade tabs A2 and D3. We take the photo. All you have to do is talk to the phone, take picture. It takes the picture. It directly transfers to the lab in real time. And with 2 mouse clips, all of the shades are compared and taken, and then we can make our restoration. But it gives you a breakdown also of what the shades are on the tooth, different sections of the tooth. So I'll show you the breakdown. So this is the technology that's used with this shade communication tool, the shade wave, and it gives us a breakdown. Look at this on the tooth on the left on the upper. We got a D2, A2. BL4, A1, everything is broken down very nicely. So we know how to build up this anterior tooth. And you can also go to their shadewave.com website there also. So in conclusion, shade matching of dental restorations materials with natural teeth is vital to producing restorations that are natural looking. And patients expect the clinicians to restore missing and broken teeth to an acceptable aesthetic appearance, and a better understanding of physical and physiological processes involved in human color vision, color theory, and shade science should enhance an appreciation for the challenges associated with tooth shade selection. With that, I want to thank everybody for joining us today. This is there's a lot more to discuss with shade taking, but I hope I encompass this in a short period of time in an understandable way. But if you have any questions or need more information, you can contact Adam or myself. We'll be glad to give you that information. Thank you for joining us today. Appreciate it.